This is NDTV, and you're watching Classics.
My life starts like this. Since being a addict person, I have no knowledge that I'll be getting HIV positive, but I keep on using drugs, injecting with friends, changing syringes, everything, day-to-day life. I kept on doing like this. Then, unfortunately, a day came that when I was tested for ELISA test, I was positive. How should I share all my difficulties like this? All these things comes up burning into my heart, because side by side there was no one to help me out. I was so lonely. It was a time that when I feel like dying, when I feel like killing myself.
Shanti tested positive for HIV and hepatitis C in 1996. Since then, hundreds of other women in Manipur have tested positive. But they say healthcare is not easily accessible, especially for women. And drug users like Shanti feel uncomfortable discussing their problems openly. In the late 90s, Manipur had been the most vocal, demanding free treatment for HIV. Now, even though the initial treatment, the first-line ART or antiretroviral therapy, is free for all over the country, patients here say ART centers in Manipur aren't functioning properly. Chandel is a case in point. Chandel, where Shanti lives, has 1,030 of Manipur's more than 27,000 persons living with HIV. But a visit to the local ART center at the district hospital was shocking. There were no doctors, no patients. The counseling room was shut. In fact, the entire hospital was locked.
Yeah, sometimes it's very difficult because of the discrimination out here in Manipur. The discrimination is very high, especially for women. But I kept on running onto myself because I want to live. I want to live like others live.
But now, even though Shanti is being treated for HIV, her liver keeps getting worse because of the hepatitis C. A blood-borne virus, hepatitis C sometimes spreads along with HIV and is as dangerous. But it's not covered under the ART program, and Shanti cannot afford the treatment on her own.
I have got no knowledge about this hepatitis C, but I went for my CD4 count test. Then through that, I came to know that I've got hepatitis C. It was an unaffordable disease for me to get care and treat. No. Taking the ART along and having the co-infection of hepatitis C, most people here in Manipur died out of this disease. Being a positive person with this co-infection, how long will I live? I just remember the prayer which I used to pray to my God, just to make me live one more day. That's the only prayer. Till today I'm living.
But unfortunately, prayers don't seem to be working anymore. In the past 1 year, 20 HIV-positive people passed away in Chandel. Most of them were co-infected with hepatitis C. In fact, every HIV-positive person we came across was co-infected, and they wanted to speak up, and not just anonymously. They all know now that the combination of HIV and hepatitis C is fatal, because they cannot use certain combinations available on the government HIV programs as they create complications. And interferon, a drug needed for those co-infected with hepatitis C, is not available through government centers. So HIV patients co-infected with hepatitis C need lakhs of rupees to treat themselves.
I'm Lucy. My name is Lucy. I'm from Chandel. I'm a widow. I'm infected with HIV. On the top of that, I'm infected HIV C. Yeah. My husband was one of IDUs. He has been expired in the year 2004. Before he was expired, I did not know my status.
Lucy works at this network of positive people in Chandel and earns 4,000 rupees a month. She has 3 children, but her medical expenses run to about 5,000 rupees a month. Not surprisingly, she's always in debt. But she's not the only one.
Let the government should take interest for us for treatment of HIV. Mostly we are widows, and most of them are they have no income. They can't afford for their children, and as I said myself also, no. Because of due to health condition, we could not work hard, we could not earn money. I haven't doing for treatment also because of financial. Because this Hep C treatment is very cheap now. I can't. There's no awareness program and all that, and mostly people are died of Hep C or infection. I myself, I think I will die of Hep C if I don't get treatment. No.
Others we met sounded as despairing. They're all realizing that there's no way they can afford the treatment for hepatitis C. Confirmatory tests alone cost 3,500 rupees. Another 2 tests are necessary after that. They cost about 20,000 rupees. The treatment takes a year and costs 6 to 7 lakh rupees. And per capita income in Manipur is around 12,000 rupees a month. So the treatment is unaffordable for most. So even though people were relieved when the government set up free treatment for HIV, the hepatitis C co-infection has been a setback to the process.
People are not aware of this hepatitis C co-infection. And only at the time of initiation of ART, antiretroviral therapy, we did some a screening of hepatitis B and C. So people came to note that the person is having HIV and hepatitis C co-infection only at the time of initiation of ART, only at the screening. So because of this transmission rate also much higher, it is said that hepatitis C transmission is almost 10 times higher than that of HIV. So it might have occurred much earlier than that of HIV also in Manipur. And the problem of hepatitis C, that we have encountered is only after initiation of ART only. Because as I've also mentioned earlier also that there is no sign symptoms, so people are not aware of it. And only after the initiation of ART, we have come across there is the complication like this that is affecting the liver, and many of the person are dying out of hepatitis C.
Chandel in Manipur, a classical case of conflict, drugs and HIV. Nothing seems to have changed in this place since the first HIV case was detected 17 years ago. Conflict has gotten worse, drugs more easily available than ever before, health infrastructure has deteriorated, and awareness campaigns have not yielded any results. And while tracking the HIV story, we've stumbled upon the new epidemic, the deadly co-infection of HIV and hepatitis C.